Hi, my name is Lucas. I am the editor-in-chief and one of the instructors for VACS. Recently, I had the chance to speak to Peter Vrooman, the United States ambassador to Rwanda. As citizens of the Western world, we're taught to see African countries as sort of the other, countries like Rwanda. Our view of them is marred by stereotypes of underdevelopment and primitivity. And while our perception of these places remains as problematic as it is inaccurate, we nevertheless have sort of the wherewithal, the foresight to know that we still have much to learn from places like Rwanda. So I had the chance to speak to Peter about sort of Rwanda's COVID-19 response and the country's use of art to heal a fragmented, divided country. I hope you enjoy the presentation. Why has Rwanda been so successful at preventing COVID so far?
Well, I think part of it is that they believe that there's a strong system of governance and a belief that government needs to serve the people and that public health is a key component of it. So they have a community-based health insurance scheme. It only costs like $6 a year, and it obviously is probably not enough to underwrite the costs that the government puts out. But people value public health, and the government provides a large measure of it, certainly for infectious disease. It's tougher in fighting more expensive non-communicable diseases such as cancer. But even there, they've built up some capacity to treat cancer and develop their own care. And one of the things that's interesting about Rwanda is that there's this belief, I don't know if you've heard of an organization called Partners in Health that started out in Haiti and has branched out to a number of countries, maybe even Colombia, I'm not 100% sure. But here in Rwanda, Partners in Health has started a medical school called the University of Global Health Equity, training a predominantly women cohort of medical students, because the idea is that there should be tertiary care and tertiary specialists in countries around the world, so that you don't send out all your patients to another country, that you're able to treat them cost effectively in the country. And that takes a lot of organization and structure. One of the key things that distinguish Rwanda from some other countries, they've been focused on transparency. So when they get cases of COVID, they disclose that, but they dedicate a tremendous amount of resources to contact tracing and then containment activities, which means bringing people to isolation centers or treatment as they need it. And they've been quite successful. I think for a country of almost 12 million people, they've had 2,000 cases, half of which have recovered or more, and only 5 deaths. So it's been pretty remarkable. I also believe that some of the success regarding COVID is linked to the work that Rwanda has done, and we've supported them, and other organizations have as well. But through PEPFAR, the President's Emergency Plan for AIDS Relief, has for almost 20 years, 15 to 20 years, built up their ability to fight a disease that has no cure and that requires lifetime of drugs. And so the network and systems that had to be strengthened and built to support those patients, there are over 200,000 of them, has been monumental and has resulted in epidemic control of that disease, where in the 80s, maybe 18% of the city of Kigali had HIV/AIDS, and we're dying of it. AIDS was used during the genocide as a weapon as a war crime. And it was also, it's only in recent years that it has been brought under control. So those techniques, contact tracing, all the sort of science and data were built up in dealing with HIV/AIDS and was very helpful in fighting and preventing the spread of Ebola to Rwanda. And then afterwards, a very different disease, COVID.
Have you noticed anything about Rwandan culture specifically that makes it such a shining star for the area?
I mean, they've had a state for hundreds of years. So they're used to very organized systems of governance. And in many ways, it's a very densely populated country, the most densely populated in Africa. So it's, the rules to live by, they've had to determine them. And of course, the genocide was the time when things fell apart. for a variety of very complex reasons. And I think if we go too far down that road, it will be a long conversation. But I do think that, they've used the community organization model. So basically working on community level health interventions, they've really prioritized that. And then strong leadership in terms of ministries of health and the scientific background and training of people to play a key role in leading the response has been critical, I think, to their success.
So just to shift gears a little bit, like what do you notice about sort of the movement in social artistry in Rwanda?
Because of the genocide, there are some strict rules about freedoms of speech that in the United States we would, with the First Amendment, not the Second Amendment, the First Amendment, we would really not clamp down on. What is called here and in many other countries, whether in Germany or other parts of the world, denial of genocide is a crime here. Or denialism or divisionism, when you try to foment or are perceived to foment division between people based on ethnicity or other differences. We in the US have a constitution that gives pretty wide berth, with the exception of threatening speech, to say even very unpalatable things from groups that espouse quite unpalatable views. So here in Rwanda, there's some constraints on that, but I think in terms of artistic expression, there's a lot of areas that the government doesn't seek to control. So many countries in the region are very hostile to people LGBTQ, right? And homosexuality is not only taboo, but it's often illegal, and people can be imprisoned for it. Here, it's not that culturally, it's not something that's well tolerated, but people are not thrown into jail because of it. And I think one of the things, I'll just give you an example. I went last summer there's a photography center here in Kigali, and they had photographers from across the continent show works that they've done across the continent. And a lot of the photographs were about very kind of mixed pictures or questioning gender identities, and a sort of an inquiry that I have rarely seen in places where there are laws that prohibit, that expression of your identity. So I always look for places, even in places where maybe the political space isn't as open. Often there's room in the artistic space for much more discussion to happen, and important discussions. I won't say they're the only discussions, but they're certainly important ones.
So I want to talk a little bit more about the Ubumuntu sort of movement. Could you sort of explain what that is?
Well, I'll first clarify that in Kinyarwanda, it's actually pronounced Ubumuntu, so that NT is like a H, Ubumuntu. So, but in other Bantu languages, it's just as you pronounce it, Ubumuntu. So that's just, but in Rwandan culture and language, the diphthongs are more complex and more difficult. I've been trying to learn it. And it means humanity. And it's interesting because there's that idea of nuh is really the essence of a lot of different words for things, persons, place, people. And you can compose and construct with that root almost everything, and even other concepts like humanity, like grace. So it's actually it's the word Ubumuntu, which means humanity, but it also, in some ways, the root of that word means almost everything. Now, Hopa Zeta, she's actually the head of the Masharika dance group theater or troupe. But the Ubumuntu festival takes place has taken place since 2015 at Gisozi, which is the genocide memorial, where 250,000 bodies are buried in a mausoleum. And so it's a very symbolically powerful place of both a memorial and a museum to the genocide against the Tutsi in '94. Last year, where I found it was a very powerful experience, because we were there with a group of American artists who some of whom had never been to America. The Collaborative Arts organization was ensemble, sorry, came, and they included a number of musicians and dancers who participated with Masharika in performing something called Generation 25. And this is what I'd like to talk about just a little bit, because what it does is it in Hope's vision, and you may have read some of this, and she could be more eloquent about it, but there's a whole generation that has grown up in the time since the genocide in 1994. And they're challenged by the necessity of remembering that horrible event. And of course, for those who are 25 and younger, they don't remember it. But in Rwanda, there's actually a famous scientist named Leon Mutesa from the University of Rwanda. And he's actually proven that post-traumatic stress is inherited. And so he's been able to do some studies with the National Institutes of Health of the US to actually prove that in the genotype, the trauma suffered by a parent can be conveyed to a child across generations. And so how does a generation, even if they weren't physically conceived, how do they capture and remember and use memory in a way that enhances reconciliation rather than bitterness and separation? And I think that message, and it's not a foolproof one, because there's not one way, there's not one performance, there's not one form of art that can help people transcend that history. But in some ways to capture the memory, but also to build bridges to and reduce barriers between people, and to increase the respect for human dignity, which is, I think, is the essence of humanity. So that's a tall order. And I think it's an area where in Rwanda, the arts are quite important. So Hope is really the glue, in my view, that helps bring people from other cultures together here in Rwanda each summer, to both as a commemoration, but also as a look forward into how a country rebuilds. And frankly, imperfect though it may be, the exercise of trying to rebuild community in the face of something as tragic as a genocide and many other killings that took place in this region of Africa over the last decades or more, is really quite profound.
Do you see any techniques that we here in North America should pull out of how Rwanda supports its artists and how the American government does as well?
You know, the challenge here is again that sometimes it's poverty. Like there's Kate Spade, which makes handbags. They have a cooperative which they work with as a partner, and the Abahinzi cooperative is in a poor mining town not far from Kigali, about a 45-minute drive. And so they built a community center that has a sprung stage that's perfect for dancers. So that's an area where Mind Leaps has been active, and where community involvement in the rural areas has a place to perform. But there really are very few places, even in Kigali, which is a very modern and very livable city, for spaces for modern dance. For classical dance, to find a place for a ballet to perform would be very hard. When I was in Ethiopia before, they had a national theater, and it was about the only place where you could have a ballet performance. And so finding those spaces for sort of the global, what we would call the global modern arts, is harder. There aren't many galleries. There is a national gallery that's actually in the former president's home, where the former president's Habyarimana's plane crashed in 1994, triggering the genocide. So it's a place where modern art coexists a little bit uneasily with the relics of the past. That said, so I think there's a fantastic culture and art museum near the near a southern town called Butare, and that's pretty impressive. But it's very hard to find some of the facilities that we may take for granted, even in a small American city or village. So that's one inequity, if you will. Yeah. So I think prioritizing art, the question obviously in any society is how much do you want government involved in art? If you look at the Cold War era of Soviet art, I'm not sure it's something to look back on. On the other hand, some forms of support for artists, either here, I think the main support is through tourism and exposure to Rwanda. It has a pretty good conference scene, at least it did before COVID. And so many people would come here for tourism and get acquainted with the art scene as well. There is some amazing painting, and some of it has been able to deal with the challenges of capturing what the genocide did to the society. And there's several brothers who run this gallery called the Enema Gallery, and they display some really provocative art that I think captures to some degree some of the vividness of the genocide, and then some of the hopes of the generation that is here afterwards. But again, that's, in any society, finding those artists that can pierce through the sort of the banal and into the profound is always, of course, the definition of what is, the lasting, amazing art. But I've seen some of that here, and it's quite powerful.